very easy to do, very cheap, and I am looking for a future where none of you will be necessary, and I won't be necessary. The medical profession will be largely redundant. We can all retrain and become artists, or musicians, or writers. No, I'm kidding. There'll always be a need for doctors. And I don't want you to think that I'm against pharmaceutical pharmacology either. It has a place. It has a place, but just not at the center of medicine. The models that we use now, when we see people with serious degenerative conditions, of course we use pharmaceutical products to treat their symptoms. But at the same time, we use nutritional programs to reduce the burden of chronic inflammation. And as that becomes less, the requirement for pharmaceuticals becomes less as well. These people are not going to be dependent on pharmaceuticals for the rest of their lives. We can use lower doses for less period of time, and in that way reduce the risk of adverse effects. The drugs themselves become safer and more practical to use. So I'm not saying it's a question of natural pharmacology versus synthetic. We use them together in truly integrative medicine. I mean, if you look at the medical textbooks of, let's say, 1900, you will see 30, 40, 50 pages on type 1 diabetes, but for type 2 diabetes, maybe only 4 or 5 pages. It was not significant. And yet today it's overwhelming us. It's so clearly a lifestyle disease. But just calling it a lifestyle disease or a disease of civilization is not enough. We have to be analytical. We have to try to understand what the factors are in the lifestyle that predispose to that illness, and then we can start to remedy it. And I think that we are at a point now where we understand the connection between your lifestyle, your diet, and your risk of disease. We actually understand what the machinery is, and the major obstacles, the major hurdles between where we are now and better health for you as individuals and for the nation. These obstacles are no longer scientific. I think that they're political, they're regulatory, and they're economic. So this is where we are. We're facing a political problem, not a medical one anymore. I do apologize for speaking too long. Thank you.